Hello again, welcome. So my name is Nikki, Communication, Knowledge Management and Learning Officer with AFAO. And great to see a lot of familiar faces and, to join us today. Not faces, I haven't seen anyone's faces, but names. So really thank you for your time, for being here with us today for the launch of the CLM Toolkit. And I'm sure more people will come, but I think we can start the launch today. This is very important for us at AFAO and AFAO. As we designed the new toolkit and we launched today specifically for SKPA2 and beyond. So fingers crossed, it will not only be useful for Asia Pacific and the 4 countries, which are, Bhutan, Mongolia, Philippines, and Sri Lanka, but also beyond, even at the global level. And CLM is not a new initiative, but all eyes are definitely directed to this effort, which will significantly contribute to strategic information on how we can provide better service for the community that we serve. So I would not talk that much. We have someone special to deliver the opening remarks or introduction. Rita Bhatia, the UNAIDS Acting Regional Director for Asia Pacific, is going to deliver the opening remarks. All eyes on you, Rita.
Thank you so much, Nikki. Lovely to see you again. Good afternoon, distinguished colleagues, partners, and friends. It's a pleasure to be here with you today. I would first of all like to thank Felicity from AFAO, the Australian Federation of AIDS Organizations, and Midnight from APCOM, the Asia Pacific Coalition on Male Sexual Health, for inviting UNAIDS to launch the new toolkit for key populations. The toolkit is titled Sustainable Community-Led Monitoring of HIV Services. This key resource was developed under the Global Fund Multi-Country Grant, SKIPA, or the Sustainability of HIV Services for Key Pops in Asia. I would really like to congratulate and appreciate AFAO, under whose leadership the toolkit was developed, and APCOM, who has worked very closely with AFAO since the first SKIPA grant to strengthen community-led monitoring in the funded countries and to develop this new resource tool. In addition, the leadership and involvement of other key organizations in community-led monitoring must be recognized and appreciated, as their engagement also helped shape this new tool. These organizations, community-based organizations, include the Asia Pacific Transgender Network, Asia Pacific Network for People Living with HIV, APN+, the Asia Pacific Network of Sex Workers, and the Philippines NGO Pinoy Plus for their leadership in this area. There are also other organizations, the subrecipients of the SKIPA 1 grant, that have engaged and contributed to this toolkit, and they too must be acknowledged here. They include Save the Children Bhutan, Family Planning Association of Sri Lanka, Community Health and Inclusion Association in Lao PDR, Youth Health Center in Mongolia, Burnett Institute in PNG, Love Yourself in the Philippines, Estrella Plus in Timor, and the Malaysian AIDS Council. UNAIDS has always been privileged to work closely with AFAO and APCOM and all the other community partners mentioned here, as well as the Global Fund for making this toolkit a reality. I'm stressing these CBOs especially because since the beginning of the HIV epidemic, communities have always been central to the HIV response. At the recent International AIDS Conference in Montreal, it was again stressed that the engagement of communities continues to remain critical at all stages in the HIV response, from planning to implementation, right up to monitoring. The conference, the international conference, also stressed the importance of empowering communities of people living with HIV and affected by HIV to collect and use their data to improve their health and to hold decision makers and service providers accountable for service delivery. So this new community-led monitoring toolkit being launched here today does just this. It shifts the dynamic to empower the community, to allow them to pinpoint the persistent, ongoing problems, identify the solutions, the enablers, and the barriers to HIV services, to ensure that the quality of HIV services is top-notch and accessible to those affected by HIV, including the most marginalized, the vulnerable, often the most left behind. As you know, community-led monitoring is a technique initiated and implemented by local community-based organizations and civil society groups, networks of key pops, people living with HIV, and other affected groups to gather quantitative and qualitative data about HIV services that are designed for them. The focus is on getting input directly from the service users in a routine and systematic manner that will allow the information to translate into action and lead to change. So community-led monitoring, or CLM, is especially important for gathering crucial information and observations directly from key populations and other underserved groups, all to ensure that no one is left behind in accessing meaningful HIV services. And the approach is focused on improving service quality rather than just generating general knowledge. The approach also focuses on analyzing the information and then informing monitoring and advocacy for change. This new toolkit lays out the principles and steps in establishing community-driven and community-led monitoring, which includes collaborative management, customization of methods, capacity building, all without being prescriptive, but rather being user-friendly and allowing for adaptability in different country settings and for different population groups. So this is where the process that AFAO and AFCOM with their partners undertook to develop this resource is noteworthy and must be acknowledged. The process was systematic, inclusive, and comprehensive. Under SCIPA 1, AFAO and AFCOM undertook evaluations of the existing CLM activities that were underway at country level, solicited input from major stakeholders about their needs and concerns. They also solicited input from the relevant government ministries to avoid any potential overlap, duplication between national monitoring efforts and community-led monitoring activities. This input from the evaluations and discussions was significant in developing the toolkit, including giving consideration to critical issues like stigma and discrimination, which continues to be an ongoing barrier to accessing services. They also outlined steps so that going forward, the data collected under CLM does not become an end in itself, but that it is analyzed, disseminated, and can be used for advocacy purposes and as a step towards enabling solutions to make HIV services accessible to those who need them. So this new toolkit was developed mindfully, taking into consideration partnership principles, population-specific needs, ethical considerations such as confidentiality, data security, and ensuring adaptability in different settings. Again, not as a prescription, but as a presentation of a process at each stage. As this new toolkit is launched today, the work doesn't stop here. Rather, it's another new beginning. under SCIPA 2, the work to take the toolkit forward will begin and get underway, starting with the development of a standardized set of CLM indicators at country level, with consensus building activities to harmonize these indicators with the national HIV program indicators, and then developing standardized operating procedures, training to build capacity around CLM, and also taking complementary regional actions that will eventually lead to the development of a regional data platform for all country and regional stakeholders. Placing communities and the most affected by HIV has always been at the core of the response at all levels. In particular, collaborating with community partners to identify barriers and enablers to accessing and utilizing HIV service has always been pivotal to this focus. So this new toolkit with its underlying concepts and principles will do just that. It will allow communities to themselves design, implement, and conduct routine ongoing monitoring of the quality and accessibility of HIV services. UNAIDS is also pleased to be engaged with AFAO and APCOM and other community partners, along with the Global Fund, in the next phase of taking this toolkit forward. Once again, huge congratulations for this initiative and best wishes going forward with it. As always, you can count on the support from UNAIDS. Thank you so much once again for giving us the opportunity to be here today.
A round of applause. Thank you so much, Rita, for the impeccable opening remarks. And we also have someone special to set the scene, Susan Perez from the Global Fund to share the importance of CLM in bringing in the community voice of why a toolkit is really needed. So Susan, are you with us?
Yeah, thank you, Nikki. So hello, everyone. It's also very wonderful seeing a lot of familiar names. Even though we can't see everyone's faces, it's just always nice to be in the presence of so many familiar names and be with you all today. So thank you again for AFAO and APCOM and the SCIPA family for inviting the Global Fund to speak today. A huge congratulations as well from us. We know that this was a lot of hard work. It required a lot of various drafts and inputs. And we just think that this is a toolkit that's really needed for the region and is filling a huge gap in providing understanding and information on CLM in the Asia Pacific region. So a huge congratulations on a really, amazing piece of work that you all have created. So in some of the prep for this, we discussed how it would be really useful for you all to hear a little bit from the Global Fund as to how community-led monitoring and communities are positioned very strongly within the new strategy. And also this is coming at such an opportune time because the funding request application materials have just been launched. So I've just prepared a very brief presentation just so that we can have the visual. I'm a visual learner, and so just to share with you a few slides about the importance of community-led monitoring for strong community systems. If you don't know me already, apologies for not introducing myself. Susan Perez, I'm based in Hanoi, Vietnam, and I'm the program officer for the Community-Led Monitoring Strategic Initiative, which was launched in 2021. And I'm also here joined by my colleague Rain, who is the focal point for the CLM C19RM investment, which is also providing CLM TA support for C19RM grants. So just letting you know that the CLM team is here with you today. Next slide. So I wanted to just share with you, as you know, this is our new strategy. And I'm not going to spend too much time, but I just wanted to point out just where communities feature very strongly within the new strategy. And you can see there on the left in the box in red, there's these objectives, these mutually reinforcing objectives. And the two there on the left are really highlighting where communities sit related to people-centered integrated systems for health, for impact, resilience, and sustainability. And then also we have the second one, which is the engagement and leadership of most affected communities in the response across the 3 diseases. And then within the strategy, if you get a chance to review it in more detail, you'll see that there are very specific health outcomes and areas where we're hoping to achieve in the next several years. And you'll see there on the left, community-led community systems and community-led programming. And then on that right, around engagement and leadership, there's a number of highlight there around supporting community and civil society-led advocacy, strengthening community-led platforms, and also community-led organizations, and supporting them to be able to deliver services to their affected communities. Next slide. So as you also may be familiar with, because you are part of SCEPA and you know very well the funding request materials and the modular frameworks, when we think about community system strengthening as a module within the RSSH module, you'll see that we have 4 priority interventions, and community-led monitoring is one of those 4. So we take this very seriously as an intervention that communities can participate and add value to ensuring that the services are reaching those who most need it and are accessible and of high quality, and really meeting those needs in a very responsive way. You'll also see that the other areas of CSS that are also supported by the Global Fund are those related to advocacy and social mobilization and capacity building, which is super important and key to ensure that we have a strong community system. Next slide. These are a few definitions that you will come across in the latest information note. As you know, with all of the new funding request materials, we have new updated information notes, and where you'll see some of this terminology feature. So in terms of this community system, we really look at that. We really regard that as the totality. So those are the organizations, the individuals, the skills, the competence, and the mechanisms that are really working together to create this community system, which we see as often linked to, but not part of the formal health system. When we think about the responses, that's really those community organizations, you all as part of this call, many of you as part of this call, as actually acting on the issues that are identified through monitoring or identified through your individual members. So those are the actions that we see from communities in terms of the responses. And then the strengthening bit are those 4 areas that were in the previous slide. And these are the areas where we really want to be supporting community organizations to strengthen their ability to respond in a active and need-based way. Next slide. So this is just showing the linkage between the systems, the responses, and outcomes. So for the Global Fund, we really want to support strong systems, because if we have strong systems, you all as community organizations and communities will be able to respond better. And through that response, we will achieve better health outcomes. Next slide. And this is just the last slide I have, just to really be able to emphasize and share with you that all of these materials are now up on the website for you to review and support with your other colleagues around participation in the next grant. And so you'll see the link is there. All of the documents are now up and available. And if you look on the right, I just wanted to point out that the RSSH, the Resilient Sustainable, gosh, I'm blanking on the actual, I use acronyms so much that you sometimes forget what they mean. Resilient Sustainable Systems for Health So the information note is where you'll find the language around CLM and CSS. So I wanted to make sure that that info note and the link to that is there, because it's sort of embedded in several documents and may be difficult to find. But we wanted to make sure that you all have that. And when you get the slide deck from Nikki and Mike, you can refer to that later. But just to say again, you know, a huge congratulations again. Thank you for, you know, all your hard work. We really are looking forward to seeing what can be done through community-led monitoring in the region. And we're also really looking forward to learning what models and best practices, as well as challenges you're facing with your CLM work. For myself and Rain, we are here supporting the TA component. We're also very much in contact with our country teams that are actually managing the grants. And so if there's any questions or any support you need, you can always come to us for those. So we remain open and are really happy to be here with you today. Thanks so much. Back to you, Nikki. Nikki, you're on mute.
Thank you. I was already yappy. Thank you, Susan. So after this, we got Mike, the technical director of SKPA2, who's going to present what the new CLM toolkit is all about. So there you go. Thank you.
Thank you very much, Nikki, and good afternoon, good morning, everybody, depending where you are. My name is Mike Merrigan. I'm the Technical Director for Skipper2. Can you see my screen okay, Nikki and colleagues?
Yes.
Wonderful. And you're seeing the first slide, right? The Community-Led Monitoring Toolkit, the intro slide?
It's very colorful. It's beautiful.
Yes, thank you. It's our new color scheme. And this is actually why the toolkit says June, but it only came out in August because we had to wait for the very important logo to be finalized to put on the new toolkit. So here you are. I think this is the first presentation with our new branding scheme. So I'm going to talk a little bit about how CLM fits into Skipper2 first of all, and the theory of change is basically our guiding framework for all the objectives and interventions. And you can see it's a 3-year project, Skipper2, which is really working towards sustainable scale up of prioritized key population HIV services. And we have 4 objectives. Accelerating financial sustainability is the first one on the left, down the bottom. Improving strategic information availability and use is the second. Promoting programmatic sustainability is a third, and objective 4 is removing human rights and gender-related barriers in access to services. Sorry if the boxes are a bit small, but you might be able to see here that CLM is specifically in the theory of change under the human rights and gender pathway to the right of the diagram. And by year 1, the expectation is that CLM and stigma and discrimination monitoring data begins to be reviewed at national level. And this, together with mechanisms for enhancing key population participation in decision-making, will work towards the year 2 outcomes and milestones, which include reduced experiences of HIV-related discrimination in healthcare settings and reduced avoidance of healthcare due to stigma and discrimination. So in that respect, for Skipper2, we really see CLM as having a clear link to programmatic sustainability due to its expected contribution to improved utilization of HIV services. So this is really Skipper2's interest and architecture, if you like, for CLM. In terms of our operational implementation of CLM, the activities themselves sit under Objective 2, improve strategic information availability and use. But as I just mentioned, it's very closely related to human rights and gender related barriers to services and removing those barriers, which is Objective 4. And to bring those two together, APCOM is our technical assistance provider. And with support from APCOM, human rights and gender work plans will be closely aligned to the CLM work stream in each country and at regional level, so that key population leaders are drawing upon evidence-based advocacy. And we do have a milestone related to CLM in the performance framework. So by year 3, we really want to see that CLM data is being used effectively to improve key population services at national and subnational levels. So moving into Skipper 2, so it's the beginning of Skipper 2 in July, and we did have CLM lessons learned from Skipper 1, where it was implemented in 4 countries, and it's great to see some of our colleagues on the call today. So we did receive several lessons learned from implementation of CLM in Skipper 1 that's led to this new toolkit. So the rationale for the new toolkit includes the need to strengthen implementation of CLM across Skipper countries and reduce duplication with stigma and discrimination monitoring. This was a point that came up in the Skipper evaluation that many of you might be familiar with. Also, the need to standardize methodology and indicators to enable cross-country comparisons and learning. And there's a big emphasis on learning between countries in Skipper 2. So we really are looking towards CLM implementation as a big part of that. I think we all appreciate that there's not enough participation right now in terms of CLM by key populations. We don't have really enough data points. We don't have really enough activity in the Skipper countries. So we wanted to work on not only standardizing the methodology, but coming up with simpler tools and approaches to really boost key population ownership of CLM by simplifying concepts, tools, and promoting flexible implementation modes. As well as, I think several people are aware of, I guess, the tension that introducing CLM can have if health authorities see it as policing the HIV services. So we'd really like the new toolkit to help build bridges between health authorities and key populations through processes that prioritize mutual respect and collaboration and not criticism and complaints. And finally, to facilitate evidence-based dialogue and agree on concrete plans of action aimed at improving HIV services for key populations. So some of the key principles of CLM in the Skipper 2 toolkit, I think this is very consistent with what Susan and others have presented already, is that CLM should be led and owned by key population communities and community-based organizations. It will only be truly effective if key local and national stakeholders are involved throughout the process. The particular issues that need to be monitored should be defined by the affected communities themselves, regardless of who is funding them. It does need to be adapted to the specific needs and barriers to HIV services faced by specific segments of key populations and people living with HIV. And it does need to be an ongoing process and based on a systematic and sustainable approach, ensuring accountability and continued advocacy dialogue. So the populations targeted, the primary focus are key populations and people living with HIV. We do recommend that it's more relevant for people who have recently used HIV services. So that limits things like recall bias and also improves the validity of the results. The toolkit is not targeted at key populations who are not engaged in or disengaged from HIV services. So I think that's an important distinction from other toolkits, is we're really asking people who have used services to provide feedback, and it's not targeting people who are not using services or who have already been disengaged with services. And the second focus, a very important second focus, is healthcare providers from target facilities and HIV service managers at the facility subnational and national levels. So this is what the toolkit looks like, the cover page, and you'll all get a copy of that today. Thank you in advance, Nikki, for sending that out. We also have a press release to go with it. I'm going to talk a little bit about some of the main contents of the toolkit now, and looking at 2 basic topics. So what to monitor and then how to monitor. So the conceptual framework for the Skipper2 CLM toolkit was adapted from the AAAQ framework, which is a patient satisfaction and health service quality framework that the UN came up with several years ago. And there's four main pillars to this. Three A's for availability of services, acceptability of services, and accessibility of services. And finally, the Q for quality of services. And you can see here, there's some, each one of those terms is broken down into different types of what does it mean by availability, what does it mean by accessibility, acceptability, and quality. So we've tried to adhere as much as possible to that while also keeping the tools quite simple. So even though we have standard indicators which look at, say, one indicator for availability, you're able to break that down into disaggregation. So you can look at the availability of specific services. You can look at demand for services that may not be available, and lots of other interesting bits by looking at the details of the analysis and not just the indicators themselves, which are a composite of different sub-factors there. So just to show you the link between this framework and indicators. So we basically have an indicator for each of these four domains of service quality. And I'm going to talk about those indicators a little bit in a second. We think this is a really good contribution to CLM practice in terms of having these indicators. We have 8 CLM key population indicators here from A1 to A8, and you just saw that there's 4 for each one of the AAAQ. We also have on top of that an indicator for participation, which I think is very important for just tracking key population participation in CLM, and then prevalence of serious incidents and stigma and discrimination. So we've classed so serious incidents obviously will need to be defined nationally in different countries, but includes things like stigma and discrimination, incidences of violence, harassment, which really do impact on key population use of services. And not only that, but they constitute serious issues of patient safety, confidentiality, etc., that the assumption is these issues need to be followed up by health service managers or peer educators or case workers, and that follow-up is important in itself. And so the next set of indicators, section B, which really are all follow-up indicators relating to any of these serious incidents reports, including stigma and discrimination. And they include things like attempts to follow up serious incidents reports, successfully following up those reports, some validation of those reports to see if they're accurate, and then referrals to services following serious incidents. And finally, the successful and timely resolution of those serious incidents. So these indicators are basically calculated through the follow-up efforts based on any serious incidents reported on the client form. So 5 indicators there. So moving on to the how to implement CLM, there's basically 6 stages in this cycle, community-led process cycle here, starting with establishing partnerships with community partners and all the way around to advocacy, engaging in community advocacy and planning for implementing improvements. So I'll talk just a little bit about each one of those stages. And again, we've tried not to be very prescriptive here, really recognizing that CLM takes different forms in different countries. It will always be the case, using different types of technology platforms and also different levels of resources. So I think it's important that these processes are fairly general, and we've tried not to be too prescriptive. Outside of emphasizing that partnerships with community partners is really the best way to kick CLM off, including that might include establishing or determining a lead organization for implementing CLM activities, and then making sure the CLM approach is owned by communities and covers the entire HIV service cascade. And it's not something that becomes monopolized by any one NGO or civil society organization. It's critical for the lead organisation to establish strong partnerships with other community-based organisations or groups involved in HIV service delivery to start things off with CLM. After establishing partnerships with community partners, the very important relationship then is with government agencies and other national stakeholders. And that's because CLM activities focus on health facilities, which usually are managed or operating under regulations defined by government. So it's critical to involve government health authorities right from the beginning of the CLM process. CLM really should be viewed and presented as an additional and complementary source of valuable information for government. And it's important not only to engage health authorities at central level, but also at the provincial, state or city level and at local level to ensure CLM data and lessons learned are widely owned and accepted. Stage 3 is adapting the toolkit and training staff on implementing CLM. So I think we've already mentioned that the toolkit is generic and needs to be reviewed and adapted to each country or province or city's need and available resources. And it should be done through a multi-stakeholder participatory approach that involves government as well, and if possible, a CLM steering committee or other technical working group. And once the adaptation is done and we're getting ready for rollout, pay some attention to the development of a communication strategy to generate awareness among key populations about the CLM and organising collaboration with selected stakeholders, training for data collectors, supervisors, data analysts and other support staff. And I think training is particularly important in the early stages of establishing the system. Stage 4 is around collecting and packaging data and generating reports. So when the data collection tools are ready and staff are trained, data collection can begin. And you'll see in the CLM toolkit for Skipper, we have sample data collection tools that match those indicators that we've presented. So those data collection tools would need to be reviewed, revised and adapted to each country and translated as well. Once that's done, we can start monitoring CLM activities on a regular basis to ensure that the system is functioning, especially during the first few weeks. Of course, we should consider pilot testing the tools as well to make sure there's not too many misinterpretation issues or language barriers or implementation issues as well. And then we move on to analysing the data, and it's really important to analyse the data at facility level, but also sometimes the numbers are smaller at facility level, and it makes more sense to analyse at a subnational level or even national level, and then to organise a feedback system to provide feedback to health facilities or those subnational levels or national levels on a regular basis as well, because there's really no point in just collecting and reporting the data without the feedback. The feedback is an extremely important process within CLM, and that's what will in fact determine whether or not services improve after the CLM data is collected. Stage 5 is conducting dialogue about findings, and this assumes that really a lot of issues picked up at local level can be resolved through dialogue. Dialogue can be organised as part of regular coordination, management, or other types of meetings with community partners, stakeholders, and with facility users. During these meetings, the findings of the CLM activities can be presented, and we've given some different examples of ways to present CLM data in the toolkit, and also templates for coming up with action plans on how to address concerns. Sometimes this can be resolved easily through the dialogue, or other times it can lead to a formalised quality improvement plan or action plan. And really sharing data and findings and recommendations as widely as possible at this stage is really important for getting that sort of buy-in and gaining some momentum towards change. The last step is engaging in community advocacy, and this is really necessary, I think, as we all know, because many issues can be solved at local level through the dialogue process, stage 5, but some issues will persist because they need to be solved at higher levels. So using findings and outcomes collected through CLM activities implemented by a coalition or alliance of partners it really makes the CLM findings more powerful and can translate into evidence-based advocacy activities that can really bring about positive change. So in the toolkits, we're really emphasizing the importance of partnerships with the institutions targeted for change, ensuring they understand where the data presented comes from and that it has been collected not to criticize, but to constructively improve health service delivery. So those are the main stages in the process. And we do have a number of tools and resources available in the annexes of the CLM toolkit that we encourage you to take a look at. I've mentioned the client form and the client follow-up form. Those are just the only two tools needed to collect the indicators that we've presented. There's an informed consent form, a template for a CLM action plan, and a code of conduct for people involved in CLM. And that code of conduct is necessary because we really do need to pay attention to ethical considerations at all stages of CLM. Remembering we're dealing with vulnerable populations, it's very important that the participation in CLM is voluntary, that they provide informed consent, that they understand what their feedback is being used for, who's it's going to, whether there's any anonymous data that's being collected. Obviously, the best practice is not to record any identifiers and to conduct CLM in confidential settings where people have privacy, both visual and auditory privacy. And most important of all is that there should be no harm done to any participants in CLM. And those participants include not just the key populations providing feedback, but also the healthcare providers whose facilities are being assessed in CLM. So there's a whole section on that in the toolkit as well. And obviously we would like to say thank you so much to everybody who has really helped us on this journey to CLM, and that includes all of the Skipper One subrecipients, and they're all listed. And thank you very much to Rita who read out the list of thank yous at the beginning. Much appreciated to APCOM for facilitating this dissemination, as well as APTN, the Asia Pacific Network of People Living with HIV, the Asia Pacific Network of Sex Workers, and the Philippine NGO Pinoy Plus. And big thanks also to UNAIDS and Global Fund for their significant contributions to the toolkit. And you also have my and Nikki contact details there for any further follow-up information and support. That's it from me. Thank you very much. Over to you, Nikki.
Thanks very much, Mike, for the explanation about the CLM toolkit. I'll be very quick. So this is supposed to be my turn. And it's about what will be APCOM's role specific to CLM under SKPA 2. Yeah, the slide, please. I have only one slide, actually. So as Mike have mentioned, APCOM will focus on the component of human rights and gender, but that includes the CLM, which is objective number 2 in SKPA 2, improve strategic information availability and use. So in this regard, APCOM is currently having new position. It's the title Community Leadership and Human Rights and Gender Officer, who will specifically look into the CLM for the country partners under SKPA 2, not only to provide technical assistance day-to-day operational, but also to facilitate discussion and initiate coordination among country partners and synergize efforts. We will take the key findings and lesson learned for powerful advocacy materials. And using that, we will create messages and communication materials for country partners in effort for cross-learning and disseminate to respective stakeholders, in-country stakeholders, by publishing quarterly newsletters and, among others, conduct a few webinars. Also, through our innovations map, which we just launched on the 1st of August last week, at the Hyatt Place, Montreal, at the Berry-UQAM, just few stations away from the convention center where the International AIDS Conference took place. It will be some sort of a platform for a close learning beyond in Asia Pacific and beyond SKPA2, focusing specifically to community-led initiatives. This platform, Innovations Map, aimed at providing information to communities to facilitate south-to-south learning and sharing with community-generated data and research. So AFCOM really believe it is very important to put community at the center, and we really want the community to be capacitated and to lead and monitor services with the ultimate goal to improve quality of life for the communities that we serve. So that's from me in terms of AFCOM's role. And for the next, we have the Q&A. And we have Michaela here with us today. Michaela Polesana from the UNAIDS Regional Support Team for Asian Pacific. Michaela.
Thank you very much, Nikki. So it's a pleasure for me to be here with all of you and to participate and be part of this amazing launch event. So I would like to welcome all of you to the Q&A session. And for this, we have 15 minutes. So I would like to open the floor, and I appreciate if you can raise your hand if you want to ask a question or write it in the chat box. So the floor is open. And I appreciate, Nikki, if you can help me to monitor who is raising their hand. Thank you. So while we're, thank you, Nikki, for the thumb up. So while we are waiting for a question from the floor, I have a couple of questions that I received here. So the first question is for SKIPA colleagues. How can SKIPA best support the rollout of community-led monitoring? Yes. So maybe I hand over the floor to our colleagues from AFAO if they want to answer this question. How can SKIPA best support the rollout of CLM?
Yeah, thank you, Michaela. And I think that's a great question. This is Mike again. You know, I think the way we can support is obviously different for different countries, and it depends on where each country is at. So I think in the Philippines, for example, there's an existing process that's going on at national level, and we're looking at how we can best contribute to that. In other countries, they may not be so far ahead, so they may be very much at the design stage, in which case we can help with some of the consultations and leading or facilitating the indicator selection and the data collection, the testing of the tools, the adaptation of the tools. So I think it really depends where countries are, and we'd really love to use this session and our kickoff workshop next week in Bangkok is to just validate whether we have the right package of activities for each country and how can we improve our alignment in terms of using that small funding, catalytic funding that SKIPA has to really make a big impact on CLM. Thank you.
Thank you very much, Mike, for your thorough answer. And now I see an hand up. May I invite you to unmute yourself and ask your question, please? Usman.
Thank you so much, Michaela. Can you hear me now?
Yes, very well. Thank you.
Thank you so much. Thank you so much, AFCOM, for facilitating this session, and thank you to you, Michaela, as well. I just wanted to have some suggestion, as I was a part of CLM that was for 2 days session in the recent past. I have gone through basically a lot of presentation sessions which have been shared by Nepal, India, and other countries as well. So the policies which they are implementing in their countries regarding the CLM are, I mean, very, very nice. I mean, they are far away, far better than Pakistan and few other countries like in South Asian countries. So I had this the same question at that time, and now I'm asking and requesting you or everybody who is here in this session. Can you guys please share those policies like the people in Nepal or India or Thailand they are implementing in their countries, which will be very much helpful for us to implement in Pakistan? Thank you.
Thank you very much for your question. Maybe I can hand it over to AFCOM or again AFAO. Colleagues from AFAO or AFCOM, if you would like to answer to the question.
Maybe I can jump in. Thank you, Michaela, and thank you, Nikki, and thank you very much for joining the call today. Yes, I think it's very interesting what's happening in Pakistan. Unfortunately, it's not a skipper country, so we're not so familiar with the context and where you're up to. But I think Susan has made a response there in the chat box. Susan, would you like to say something about that? How it could be used in Pakistan?
Yeah, sure. So I just put there in the chat that Treat Asia was working with Cone in India and Peduli in Indonesia to carry out CLM in several sites. In India, it was in Manipur, and then in Indonesia, it was in a few sites where they're providing HIV and hepatitis C services. So I was just noticing and listening to your question, saying that if there were examples from India, that could be very helpful. So I can send to Mike and Nikki the link to that data analysis report so you can get some more information, and then maybe you can reach out to Geetan at Treat Asia for more information. I hope that would be helpful, but just please let us know.
Thank you, Susan and Mike, for your important guidance. And now I can see another hand up, Marlene from UNAIDS. Marlene, the floor is yours.
Hi, Michaela and everyone. Thank you so much. Mine is not actually a question, but just thinking about, first, thank you so much. I think this is a very important tool. We've been hearing about this and now it had evolved. There is now a tool that countries could use. But I was just thinking about one major challenge in trying to adapt. And I think this was already mentioned, adaptation of this tool at the country level and even at the provincial level where the HIV response is decentralized. There are countries, including Vietnam, that have developed a new national M&E plan in line with its national strategy on ending AIDS as a public health threat by 2030. And I wonder how this could be integrated into the current plan. So perhaps a lot of conversation has to happen at the country level, certainly guided by this tool. So then we can really translate this tool into real action on the ground. Over. Thank you.
Thank you, Marlene. Who would you like to ask the question to?
Yeah, not really a question, but just for us to think on the how.
Thank
you. I think this is very important, but it's really, the tool is there. It's like a lot of documents are available, but how do you translate this into action on the ground? But especially a toolkit like this in a decentralized setup like in Vietnam, where we have like 62 provinces. And I think it also holds for other countries. Pakistan is also a very decentralized setup, especially for HIV response. So it's just thinking about, should we prioritize first or should we just dive into it? So perhaps some guidance on that would be very helpful.
Thank you very much, Marlene, for your important reflection. So I don't know if colleagues from AFAO, Global Fund or AFCOM would like to jump in to address these comments, or we are taking notes and we can come back also later. There are a few more questions here. I'm going to read 2 questions from the chat box. One is from Rain. So one question, does the CLM toolkit include some considerations, flexibilities in relation to COVID or other pandemic restriction, limitation, impact? Thank you, Rain, for your important question. And I think maybe Mike or Nikki can answer, please. Mike, I think you have unmuted yourself, so I hand the floor over to you. Thank you.
Thank you, Michaela. Thank you, Rain. Thank you very much for the question. That's a great question. And I think the answer is yes. The toolkit does, although it's not explicit in the toolkit, COVID related precautions. I think it comes down to how's the toolkit administered. And we're really interested in seeing good use of information technology. So there should be less need to do it in a face-to-face basis. We should be able to fill in these CLM forms on smartphones and things like that, maybe through an automatic link or a message or an email after receiving a service. So I think there's some really promising examples of making good use of information technology to collect CLM data that don't involve face-to-face interactions. And if the settings enable that in terms of the information technology and people having smartphones, which is the case in most urban areas in the countries we're working in, then we definitely encourage use of smart use of information technology to remove the need for these close contacts with people for CLM. Thank you.
Thank you, Mike, for your thorough answer. And I'm going to read another question from chat box, and then I'm going back to the floor as I can see that there is another hand up. So let me read the question that comes from Surillo. I apologize for my pronunciation. So actually there are two questions. The first one is CLM tool only used on SKIPA 2 countries. The implementing organization who is doing HIV services funded by Global Fund can use this tool. I think either Mike or Nikki, would you like to address these two questions?
Go ahead, Nikki.
Oh, no worries, Mike. You can leave.
So I think the answer is yes. It can absolutely be used in other countries, and anybody is welcome to use it. Yes, it's open to non-SKIPA 2 countries, and it's a resource that should be available to everybody. And we're certainly happy to have discussions with the non-SKIPA partners or non-SKIPA countries about the toolkit. We'll be happy to send it to you and have some follow-up discussions about that as well.
Thank you, Mike. And now I give the floor to Manor. Manor, may you kindly signal who your question is for, please? Thank you.
Hello, everyone. First of all, I really want to acknowledge the very comprehensive toolkit which I have received. I just wanted to recommend if I missed anything in it, like there is a proper cycle we have made under the CLM model. And under that cycle, we have a tool process specifically establishing the partnership with other community partners and establishing or strengthening the relationship with government agencies and other national stakeholders. So I would recommend, we need to incorporate any toolkit or any mapping kit in the CLM model, so we can prioritize the stakeholders to whom we need to reach out to improve the service delivery by CLM through CLM. So this is just the advice from my side.
Thank you very much, Manor. The advice is well taken. Thank you very much for your great suggestion and reflection. And I think we can take one more question as we are short on time. And I see an hand up from Luis Ocampo from UNAIDS. Luis, the floor is yours for the last question of this session. Thank you.
Yeah. Thanks, Michaela, and congratulations to UPCOM and AFAO for this very critical document on CLM. There is a section on resourcing and financing. However, I was actually looking for guidance or any recommendations on how to source, the system. Once it operates, it would need resources, operational cost, equipment, and even salaries of people who will be managing the system. So the costing categories are already there in the document, but on how or what are the possible resources that can be tapped for the operation of CLM. So perhaps we can further discuss on this one, if not included in because I think it's already we're going to publish already the toolkit, but perhaps in the next iteration we can include that part. Thanks.
Thank you, Luis, for your reflection and comments. I don't know if anyone would like to address Luis' considerations. Otherwise, Nikki, I think there are more questions in the chat box. I think we are taking note of all these questions and we will get back to our participants as the time is ending for this Q&A session. So Nikki, do you agree if we conclude it here and I hand it over to the next panelist? Excellent. So thank you. I would like to thank our speakers for their intervention, but also to our audience for this great engagement. So I would like to pass the floor over to Hari Prabowo, Program Manager from APM Plus, for the closing remarks. Thank you very much.
Thank you, Michaela. Thank you, Nikki. Thank you, Mike from AFAO and Felicity for allowing me to speak during these providing closing remarks. Now we are almost at the end of today's virtual event, which is the SKPA2 Community-Led Monitoring Toolkit launch. On behalf of the community, we would like to say thank you to SKPA AFAO for developing the CLM tools based on the implementation carried out through SKPA implementation funded by the Global Fund. As mentioned by Susan earlier, that CLM is the community intervention link or part of the community system strengthening. And with the SKPA2 CLM toolkit, we now can understand what the CLM is and what the CLM can be monitored, what should be considered in planning and implementation, and how to use the CLM funding to improve services. Having great tools will help the communities, especially on how to carry out the CLM at the grassroots levels. But another challenge still remains on how our strategic information obtained from the CLM is being analyzed and taken into account by government and stakeholders at all levels. That being said, we, as the Asia-Pacific Region Network, currently is undergoing a joint project supported by UNAIDS RST. We will develop a regional roadmap on CLM, as well as regional capacity building on CLM. We hope that this joint project not only strengthen the network, but we hope it also will provide further support for the community at the country levels to scale up their work on CLM, especially relating to some reflection raised during the Q&A. Just remember, community should be in the center, nothing about us without us. Thank you, and hopefully we can see you soon. Back to you, Nick.
Thank you so much, Mas Hari Prabowo, for such a beautiful closing remark from the community network. Before we end the session today, we really want to ask everyone who is comfortable to open their camera to have a photo shoot so that we have some sort of proper documentation for this event, and also to see each other, beautiful faces. And yeah, are we agree? No, not are we agree. Are you ready?
I'm ready, Nikki.
Awesome. Bien. Okay, let me count. So we're gonna do 2 shots. Okay, so let me count. 1, 2, 3. Okay, change pose. 1.